Okay, I want to talk now about cardiovascular disorders and how they affect pregnancy and how pregnancy affects heart difficulties. There are some normal changes that happen in pregnancy. We have increased intravascular volume. Remember that the blood volume is 50% greater. We have decreased vascular resistance. We have some vasodilation. We have increased cardiac output. And in the immediate postpartum period, all of those changes go away. Our vascular system goes back to acting like it's not pregnant. We eliminate that extra 50% blood volume, and that happens pretty rapidly, okay? Keep those things in mind when we start talking about patients who have cardiovascular disease underlying. The New York Heart Association has some functional classifications of heart disease. You don't have to memorize these, but you need to understand that we kind of group heart disease by severity. Class 1, this person is asymptomatic and has their physical activity is normal. They tolerate physical activity. Class 2, they're symptomatic. They have some limitations on physical activity. Class 3, they're symptomatic. They have marked limitation of activity. Class 4, they're symptomatic, meaning to the point that they cannot carry on any physical activity without some symptoms. So what happens when we have someone who has underlying heart disease and we add all of the cardiovascular changes of pregnancy? So it can actually cause people to worsen, to progress in these classifications, and it can cause some acute complications. So let's talk about some different options. If we have someone who has congenital heart defect, the complications in pregnancy really depend on the type and the severity of that defect. And we're going to talk about those defects in detail later on in the cardiovascular pediatric lecture. So right now, we're just going to talk about the major complications, okay? There are two major things that can happen with, or there are several, but there's some major things that can happen with with congenital heart defect. They can have CHF, they can have pulmonary hypertension, okay? They can have hypertension. They can have a hypoxemia, not be able to get enough oxygen. Two of the major effects of congenital heart disease are going to be CHF. That means they cannot pump forward, so they get fluid overload, or not being able to get blood oxygenated. Okay, so that has to do with right and left side of the heart, right? So they can't get blood through the lungs, they can't get it oxygenated, they can't get blood to the kidneys, they can't get fluid eliminated. So if they already have some of those complications, then pregnancy is going to make them worse. But pregnancy can also cause, in patients with heart disease, arrhythmias. It can cause an increased risk of blood clots. It can cause pulmonary hypertension when the vessels going to the lungs are constricted and it's harder to get blood through the lungs to get oxygenated. It can cause endocarditis, which is infection in the inner lining of the heart. Aortic dissection, or a ruptured aneurysm. There are certain birth defects that make the aorta weaker. Fainting and death. So someone with severe underlying heart disease is at greater risk of death during pregnancy. Management of heart disease, if they're at increased risk for blood clots, they need anticoagulants. If they're symptomatic at all, they need greater rest and limit activity. If they're at risk for infection, like endocarditis, they get antibiotics. Any heart patient who is symptomatic, the first choice of delivery you would think would be C-section. Remember, though, the potential negative effects of anesthesia on the cardiovascular system. So the first choice is a vaginal birth with a heavy epidural, and either forceps or vacuum, so some kind of assistance. If they have a condition that decreases the amount of venous return they have, then we need to position them and have pressure stockings on them to help make sure they're getting enough venous return. Okay, so in the next section, we're going to talk about some acquired cardiac diseases.